Welcome again to the Medical Terminology Podcast. This episode is Chapter 14, Part 4, Female Pathologies. Our first term is that for a specialist in diagnosing and treating diseases and disorders of the female reproductive system, and that's gynecologist. Gynecologist. And now we're going to look at some general pathologies. The first term is pelvic inflammatory disease, abbreviated PID. Pelvic inflammatory disease is any inflammation of the female reproductive organs that is not associated with a surgery or a pregnancy. This is often a complication of a sexually transmitted disease. The next term is oophoritis. oophoritis. Oophoritis is inflammation of the ovaries, and this often accompanies pelvic inflammatory disease or salpingitis. And what is salpingitis? Well, salpingitis is inflammation of a fallopian tube. salpingitis, salpingitis. So those three terms all kind of go together: pelvic inflammatory disease, oophoritis, and salpingitis. And then we have pyosalpinx, pyosalpinx. Notice that uses that suffix salpinx for fallopian tube. And I hope you remember pyo means pus. So a pyosalpinx is going to be an accumulation of pus in a fallopian tube. Our next term is polycystic ovary syndrome. polycystic, that's polycystic, ovary, ovary, and then syndrome, syndrome. Polycystic ovary syndrome is caused by a hormonal imbalance. The ovaries become enlarged by the presence of cysts formed by incompletely developed follicles. And again, the follicles are the little sacs that contain the eggs. The next term is endometriosis, endometriosis. Remember, the endometrium is what? Do you remember what the endometrium is? Well, that's the inner layer or lining of the uterus. And so endometriosis is going to be an abnormal condition of that, right? Specifically, endometriosis is a condition in which endometrial tissue escapes from the uterus and attaches itself to other structures within the pelvic cavity. And this is a leading cause of infertility. Then we have cervical dysplasia, cervical dysplasia, dysplasia. And remember, dysplasia would be a difficult or abnormal development of something. In this case, cervical dysplasia is the development of abnormal precancerous cells on the cervix. And cervical dysplasia is detectable by the Pap test. Well, let's quickly review these terms. What is the term for any inflammation of the female reproductive organs not associated with surgery or pregnancy? Well, that's the pelvic inflammatory disease. What is the term for inflammation of the ovaries? Well, that's oophoritis. oophoritis. And what is the term for a condition in which the ovaries are enlarged by the presence of cysts formed by incompletely developed follicles? That's the polycystic ovary syndrome. And what is the term for accumulation of pus in a fallopian tube? That's pyosalpinx. Pyosalpinx. And what is the term for inflammation of a fallopian tube? That's salpingitis. Salpingitis. And what is the term for the development of abnormal precancerous cells on the cervix? That's cervical dysplasia. Cervical, then dysplasia. And what is the term for the condition in which endometrial tissue escapes from the uterus and attaches itself to other structures? That's endometriosis. Endometriosis. Okay, and then I have a few more general pathologies for you. We have the term for yeast infection, and that's vaginal candidiasis. Vaginal, and then candidiasis. Remember, candidiasis is kind of a general term for yeast infection. And then we have bacterial vaginosis. Bacterial, Bacterial, and then vaginosis, Vaginosis. Bacterial vaginosis is an overgrowth of normal vaginal bacteria. Next we have pruritus vulvae, Pruritus vulvae, Vulvae. And do you remember what pruritus means? That's from chapter 12. Pruritus means itching. Vulvae is going to refer to the vulva, right? So this is going to be the medical term for what? Well, that would be what's commonly known as external genital itching. And then we have the term vulvodynia, Vulvodynia. Vulvodynia is a syndrome of unknown cause that includes chronic burning pain or itching in the vulva. And notice this term prefers dynia, dynia, which means pain, right? Rather than the more common algia, vulvodynia. Okay, now we're going to go back and practice with all of these general pathologies. Number 1, what is the term for a vaginal yeast infection? That's vaginal candidiasis. Vaginal candidiasis, candidiasis. What is the term for any inflammation of the female reproductive organs that's not associated with pregnancy or surgery? That's the pelvic inflammatory disease, pelvic, PELVIC, inflammatory, INFLAMMATORY, And then disease, DISEASE, commonly abbreviated PID. Now here's a bonus question. What is the common cause of pelvic inflammatory disease? Well, it's commonly caused by an STD or a sexually transmitted disease. What is the term for the condition in which the tissue from the inner layer of the uterus attaches to other pelvic organs, and it's a leading cause of infertility? That's endometriosis. ENDOMETRIOSIS. And what is the term for pus in a fallopian tube? That's pyosalpinx. PYOSALPINX. What is the term for a syndrome of unknown cause in which there's pain and burning in the vulva? That's vulvodynia. VULVODYNIA. An overgrowth of normal vaginal bacteria is known as what? That's bacterial vaginosis. Bacterial, BACTERIAL, and vaginosis, VAGINOSIS. What is the term for the development of abnormal cells on the cervix? That's cervical dysplasia. CERVICAL, dysplasia, DYSPLASIA. A condition in which the ovaries become filled with cysts formed from incompletely developed follicles is known as what? Well, that's the polycystic ovary syndrome. POLYCYSTIC, ovary, OVARY, and syndrome, SYNDROME. And what is the term for inflammation of the ovaries? That's oophoritis. OOPHORITIS. And finally, what is the term for female genital itching? That's pruritus vulvae. PRURITUS VULVAE. Okay, in part two, we have some terms related to menstrual disorders. There's a lot of them listed in the chapter here, and they tend to be pretty confusing. And I've tried to subdivide and reorder them, and hopefully it will make it easier for them to learn. First of all, we have a term for normal menstruation, and that term is menorrhea. MENORRHEA. Remember, meno refers to menstruation, and rhea refers to flow. This is normal menstrual flow. Then we have a term for any abnormal uterine discharge, and that is metrorrhea. METRORRHEA. Metro refers to uterus, rhea means flow. Okay, and this could make it really confusing because obviously menstruation comes from the uterus, right? menorrhea is a flow from the uterus, but this is the menstrual flow, the sloughing off of the endometrial lining. Whereas metrorrhea is any kind of abnormal discharge. It could be anything. Okay, and then we go on to the menstrual disorders. The first group I've made up here are disorders that are related to the quantity or the quality of flow. We're talking about the menstrual flow itself. What is it doing that could be abnormal? The first term is dysmenorrhea. Dysmenorrhea. Again, notice word parts. Menorrhea refers to menstruation, normal menstruation, but dys means what? Bad or difficult. So if we have dysmenorrhea, we've got painful menstruation. We're basically talking about having a lot of strong cramping during menstruation. Then we have hypermenorrhea. Hypermenorrhea. Hyper means too much or excessive, right? Hypermenorrhea would be greater than normal or excessive menstrual flow. It would be extra heavy flow. And then we have hypomenorrhea. Hypomenorrhea. Hypomenorrhea would be less than normal menstrual flow or extremely light flow. So if you go back and look at these terms, they're all based on the term menorrhea. They're all describing the amount of flow or the quality of the flow. The flow is painful. You're having painful menstruation, dysmenorrhea. The flow is extra heavy, hypermenorrhea, or the flow is really light, hypomenorrhea. Then we've got some terms that relate to disorders of frequency. This isn't describing the period itself, it's describing how frequent the period is. Is it on time or not, basically? The first term is oligomenorrhea. Oligomenorrhea. Oligo normally means scanty or lacking. Oligomenorrhea means fewer periods than normal. In other words, there's going to be some missed periods some months. We need to be careful to distinguish that one from hypomenorrhea. Hypomenorrhea is commenting on the amount of flow. There's less flow than normal. Oligomenorrhea isn't saying anything about the flow itself. It's talking about the frequency of the periods. There are fewer periods than normal. And then the opposite of that is polymenorrhea. Polymenorrhea. Polymenorrhea would be more periods than normal. There might be some extra periods in there. Then we've got the term amenorrhea. Amenorrhea. A means without or absent. This would be the absence of menstrual flow. In other words, the woman is not having any periods at all, and this would be an abnormal condition unless one was menopausal. Okay, and finally we've got a term that refers to excessive flow that is heavier than normal flow and more frequent than normal periods. And this is a mouthful. It's menometrorrhagia. Menometrorrhagia. Menometrorrhagia means more periods than normal, and the periods have greater flow than normal. And the word parts are completely different than the other terms. We have meno, which refers to menstruation. Metro refers to the uterus, and rhagia means bleeding. So it's a completely different combination of word parts from these other terms. Menometrorrhagia. Okay, now we're going to review and practice with these terms for menstrual disorders. Number 1. What is the term for any abnormal discharge from the uterus? That's metrorrhea. Metrorrhea. What is the term for painful menstruation? That's dysmenorrhea. Dysmenorrhea. What is the term for having fewer periods than normal? That's oligomenorrhea. Oligomenorrhea. Now, what is the term for having less than normal menstrual flow? That's hypomenorrhea. Hypomenorrhea. What is the term for having more frequent periods than normal and having periods that have a greater flow than normal? Okay, that's that wild term, menometrorrhagia. Menometrorrhagia. And what is the term for having heavier than normal menstrual flow? Heavier than normal is going to be hypermenorrhea. Hypermenorrhea. And finally, what is the term for the absence of menstrual periods? That is amenorrhea. Amenorrhea. Okay, that covers the female pathologies, both some general ones and then some ones that are specific to the menstrual cycle. And in the next episode, we're going to go ahead and look at female procedures. This ends this episode of the Medical Terminology